seated. Thank you. His Excellency the President, President Cyril Ramaphosa, the Minister of Health, Dr. Joe Patha, MCs of Health present, senior officials, representatives of the health fraternity, representatives of civil society, labor, members of Parliament's portfolio and select committees present, public representatives, leaders of progressive political parties, including the governing party, who are present here, members of the media, distinguished guests, ladies and gentlemen, good afternoon. My name is Vincent Ogwenya. I'm the spokesperson to the President, and I've been tasked to steer the proceedings for this afternoon as we witness the historic signing of the National Health Insurance Bill. In the year in which South Africa is celebrating 30 years of freedom and democracy, today we are here to mark another significant milestone in the evolution of our constitutional democracy and in our ongoing quest for social justice. That's what the signing into law of the NHI bill represents. Shortly we are going to hear from the Minister of Health, Dr. Joe Patha, who has, together with his team in the department, his predecessors and many others who wanted to see this dream of the delivery of universal healthcare access, have traversed a long journey that has finally led us to this momentous occasion. Just a few housekeeping rules. If we may all please keep our phones on silent, that would help. Thank you. Ladies and gentlemen, program for this afternoon. First to come to the podium will be the Minister of Health, Dr. Patha. At the conclusion of his remarks, the Minister will then do the honors of inviting the President to deliver his keynote address. Thereafter, we will invite the President, carrying his pen, which we've tested and ensured that it works, flanked by Dr. Patha, as well as the MCs of Health to the front, to then sign the NH bill into law. Once the President has discharged his constitutionally mandated duty, he will then take leave of us. Dr. Patha will remain behind to take questions from the media colleagues. So without taking up any more time, I'd like to invite the Honorable Dr. Patha, the Minister of Health, if we may please give him a round of applause.
Thank you very much. Present, Deputy Minister Jomo, my colleague in the health portfolio, and other Deputy Ministers present, MCs who are here, thank you very much, colleagues, for coming at a very short notice. We have the MC for Free State, MC from Northwest, from Mpumalanga, Gauteng, and also my home, the Great North. Great Limpopo. Thank you very much, colleagues, for being here. The chair of the portfolio committee, both the portfolio committee and also the select committee from the National Assembly, and also from the Council of Provinces, the NCOP, the advisor to the President, Professor Shisana, who's played a major role from earlier on up to now at the end of this journey. Director General in the Presidency and all other Director Generals and all senior officials from my department, also DG Telesi, Leaders of all various organizations, political organizations, the Alliance, and all other formations from civil society, business, and also from labor present here. Ladies and gentlemen from the media and all, everybody present, Dumelang, Sanbonani, Abshe, Dimasiya. Thank you very much, Mr. President, for convening us here at this citadel of power, the Union Building. After a long search for a pen, and that the pen, the most valued pen in the country and in the history, Minister Zimani did see earlier, and the President has finally found the pen, very, very good pen, and it will go into annals of history. I'm sure it will also be kept in the museum after this. Today indeed marks a very historic milestone as we are here to witness the signing of the National Health Insurance Bill into law, a transformative leap in our nation's health policy. This law is derived, amongst others, from the aspirations of the National Development Plan 2030, which sets us on a course that enables us to guarantee that every South African will have the right to access to comprehensive healthcare services, free at the point of delivery. The vision of the ANC as the oldest and leading liberation movement for South Africa, also leading in the health area, we can be traced backwards into the African claims of the early 40s, as expressed in the African Claims document under the leadership of President A.B. Kuma. Just to inform the President and colleagues here that we've also named our headquarters the A.B. Kuma building. We will be having the family sometime next week to inaugurate the A.B. Kuma building as the national headquarters of the Department of Health. Even at that time already outlined the kind of future health system which was required in the country. In one of the clauses of the document, I quote, it says, it calls for the establishment of free medical and health services for all sections of the population. That is in 1943. While the other clause calls for, I quote, a drastic overhaul of the health services of the country with emphasis on preventative medicine. That's that time. So those many years, almost 80-something years ago. But the journey to today's landmark moment also was started as early as our first democratic dispensation in 1994 with the post-apartheid government laying the foundation for the health reform. Over the decades, numerous committees, inclusive of diverse professionals and stakeholders, have been diligently working to shape the future of our health system. And I'm happy to see many comrades who are part of many of those discussions day and night, when we hammered out the various issues. Through extensive public consultations and after assimilating numerous comments in the new government, in the new dispensation, a green paper was developed, ultimately leading to a white paper which laid the groundwork for the NHI bill ultimately. Within our context, historically, healthcare costs have unfairly burdened most vulnerable members of our society for a long period. Families have faced agonizing decisions, sometimes having to choose between basic necessities and the necessary medical care. This reality does not align with our vision of the country where we envision citizens should enjoy a life to the fullest. The inequities and inequalities that characterize our health systems are unjustifiable and require fundamental overhauling to ensure equity and sustainability as called for as early as 1942-1943. As we steadfastly continued with our efforts towards realizing a healthier, more prosperous South Africa, we must recall also the Freedom Charter, which says, quote, "A preventative health system shall be run by the state. and free medical care and hospitalization shall be provided for all, with special care for mothers and young children. That's the Freedom Charter 1955. Leveraging the values and principles espoused in the Charter, the NHI has been under serious consideration since the dawn of our democracy. The primary objective of the NHI reforms are directed at unifying our fragmented health system and ensuring that Section 27 of our Constitution is realized, which guarantees access to health for all in the country. And it's even broader than just citizens, but access to all in South Africa. Informed by also the National Development Plan, which outlined a framework for ensuring that by 2030, South Africa should have achieved a significant shift towards equity, efficiency, and quality of health service provision, as well as realizing universal health coverage. So that's the policy framework also, which informs the fundamental principles of the NHI. The implementation of this NHI is therefore not just a policy issue, it's a commitment to the well-being of all South Africans. It is important to emphasize that this policy development, as we have mentioned, started in the early 2000s with a green paper and ultimately reaching to the legislation, and there have been several consultations processes undertaken with all the inputs and comments which have also been taken into consideration to make sure that many South Africans played a role in the framing of this act, this bill, which is soon to become an act. It was submitted it was approved by Cabinet in July 2019 and then submitted to Parliament, which then started the process of processing in the National Assembly under the leadership of the now Deputy Minister and former Chair of the Portfolio Committee, Deputy Minister Zomo, enabled by the whip of the committee, Comrade Honorable Munyai. Good to see you, sir, being here, having been the whip of the committee, always whipping us to make sure that we can drive this process. Following further consultations and appropriate amendments, the Assembly passed the bill in June last year, and then from there was referred to the National Council of Provinces. I see also our chairperson of the NCOP also being here. Thank you very much, Honourable Member, for also steering this process. And finally, on the 6th of December, the NCOP passed this bill by support of 8 out of 9 provinces. And it is then that... So anybody who claims that this was parachuted and there was no proper consultation, this process just within the NCOP, there were more than 60 public hearings in all provinces. Almost every district was given a chance. Various submissions, all of them were taken into consideration. And subsequently, therefore, was referred to His Excellency the President. We are happy that after many years of policy discussions and 5 years in Parliament, this bill is now it's reached the stage where it is now, which allows that once it is enacted, which will allow the Department of Health to commence with implementation and to create the mechanisms for equitable, effective, and efficient utilization of the resources available to the country. Because the reality, as we say to many naysayers, South Africa is not short of resources. We're already utilizing 8.5% of our GDP for health. Within the public sector as well, already reached the Abuja declaration of 15% in the allocation of the budget. What is required is that almost 51, 52%, which is used for only 15% of the population, must be integrated into to be fully utilized for the whole population. So, ladies and gentlemen, we are happy to be here today to bear witness to this seminal moment in our history. We stand resolute and committed to realizing a health system that ensures that our people enjoy healthy and productive lives, spurred on to achieve their full potential in a more equitable country. This law is not just a policy, as I've said, it's a promise. We are making a promise to our people for a better and more healthier future for all South Africans. It's not partisan. For those who may be told lies that this is electioneering, is what. This is for the betterment of all South Africans, we want to emphasize. This law represents a comprehensive, transformative approach to health delivery. It is founded on the principles of equity, sustainability, fairness, social solidarity that ensures that every South African, regardless of their socio-economic status, should have access to comprehensive health care. And now that the bill is soon to become an act, it creates a statutory mandate that will enable the establishment of the key institutions and the organizational structures, key to which will be the actual National Health Insurance Fund and its various governance structures, which will be established once all the various key provisions have been proclaimed. We must, however, emphasize the fact that this is not going to be a once-off, event. It's going to be a process. The bill itself outlines various phases, so we're going to follow the phases as outlined. Our intention has always been to implement in a rational, structured, and phased approach. The Constitution does empower the President to set different dates for effectiveness of clauses of an Act. Therefore, the phased implementation of the Act will be undertaken with due consideration to all the specific sections when they're ready to be implemented, proclaimed and implemented, and will also have to follow the steps in terms of regulations, directives, and all that. And all those are outlined in terms of our Constitution and law, even in the bill itself, the various processes of consultations, 90 days in most cases in terms of regulation. So we are going to be able to follow all this and finally establish a Schedule 3A entity in terms of the Public Finance Management Act. The Act, of course, does empower the minister to appoint a board, but also it's very clear that the people who are appointed there must be people of good standing. There will be a public process. All those will be done accordingly. There will be regulations, and all the regulations will provide all the processes. So we do expect that all these processes, which have already started in anticipation, we already have some of the drafts, that within 6 to 12 months, the institution, at least the fundamental structure, will be established. Within 6 to 12 months, we expect that with all the groundwork which has been done, this will be so. There will be some challenges, but we believe that we will overcome all those obstacles. So there's been a lot of work done. So we want to invite all the role players to join us in this journey and to become part of the solutions rather than be part of the obstacles. And I want to specifically invite especially our healthcare workers and professionals to say to them, don't listen to the doomsayers. Don't listen to the doomsayers. There are, scaremongers out there who are telling them things are going to collapse. You must leave now. Now that the president has found the pen, found the next flight, stay here. Things are going to be better. That's what we want to say to our professionals. We're going to make sure that what has been achieved over 30 years can only get better and not get worse. Ladies and gentlemen, it's now my honor and privilege to invite our Commander-in-Chief, who led us in the worst of times. I know many of you forgot that there was something called COVID already. You've forgotten the family meetings. You've forgotten. Now, this is our leader who led us through those very important family meetings at difficult times, not only in the country, but in the continent and also in the world. But I must say also to the doomsayers, this is the president who's also leading us out of load shedding. I'm sure even those who have been skeptical must now accept that we're making progress. Almost 50 days and counting. So even this one is going to succeed. Honorable Excellency President Ramaphosa, I invite you to address the nation.
Thank you. Let's be seated, please. Dr. Joe Pahla, Minister of Health of the Republic of South Africa. The MECs of Health from a number of our provinces. Who are here present, representatives of Labour, representatives of various political formations in our country, members of Parliament, particularly the Portfolio Select Committee members, whips and what have you, public representatives and members of the media, distinguished guests, and ladies and gentlemen. We are gathered here today to bear witness to the signing into law of the National Health Insurance Bill, which at the stroke of the pen is about to become an act of Parliament. This is clearly a pivotal moment in the transformation of our country and, in fact, in the history of our country. It is a milestone in South Africa's ongoing quest for a much better, just society. This transformational healthcare initiative in many ways gives further impetus and effect to our constitutional commitment to progressively realize access to healthcare services for all its citizens. In its essence, the National Health Insurance is a commitment to eradicate the stark inequalities that have long determined who receives in our country, who receives adequate health care, and who suffers from neglect. By putting in place a system that ensures equal access to health care, regardless of a person's social and economic standing and circumstances, the NHI takes a bold step and a stride towards a society where no individual must bear an untenable financial burden while seeking medical attention. Now, this vision is not just about social justice, and this vision is not a new one, as you have heard, and I'll refer to it a little later. It is also about efficiency and quality. The provision of healthcare in this country is currently fragmented. It is unsuitable and it is wholly unacceptable. The public sector serves a large majority of the population but faces budget constraints. The private sector serves a fraction of society at a far higher cost without a proportional improvement in health outcomes. Now, addressing this imbalance requires a radical reimagining of resource allocation and a steadfast commitment to universal health care, a commitment we made to the United Nations. And let it be clear that universal health care is a global initiative in many ways, where a number of countries are moving towards universal health care, and we as a country have made a global commitment that we are going to have universal health care. So those who are trying to hold us back to a fragmented system are completely out of line with the global vision that has been set, which we are a part of. Remembering that South Africa is part of the global community. So we are not mad. We are not outliers. We are very much in line with what is happening in the global community. The real challenge in implementing the NHI lies not in the lack of funds, but in the misallocation of resources that currently favors the private health sector at the expense of public health needs. That's where the problem is. The NHI bill presents an innovative approach to funding universal health care based on social solidarity. And solidarity is important. It's an important concept, and I digress for a minute by also reminding us that when we faced a global challenge which was brought about by COVID-19, we harped on the issue of solidarity. And we kept saying we want international solidarity so that those countries, particularly in the Northern Hemisphere, who have been able to have much better systems, aided and abetted by the colonialism, the empowerment that they received from raping and pillaging the resources of countries that they had colonized, that they must pledge solidarity. And we did so when it came to vaccines, we did so when it came to PPEs, we did so also when we came to debt relief. And we said, we need solidarity. And it was embraced to a large extent, even by those in the Northern Hemisphere. So this concept of solidarity proposes a comprehensive strategy that combines various financial resources, including both additional funding and reallocation of funds already in the health system. This approach ensures contributions from a broader spectrum of society, emphasizing the shared responsibility and mutual benefit envisioned by the NHI. I repeat, the shared responsibility that we all have as South Africans. Now, the financial hurdles facing the NHI can be navigated with careful planning, strategic resource allocation, and a steadfast commitment to achieving equity. And let me repeat, achieving equity. And this is, I want to emphasize this point, that achieving equity is what the struggle against apartheid has been all about. And it continues to be about that we should have equality. Now we cannot have a situation where there is a portion of the South African population that continues to live under an unequal system, whilst the others continue to live under a privileged type of system. This is completely against what the ethos of our democracy is. So for those who would like to see those privileges that they've continued to enjoy continuing, sorry, you are on the wrong boat. The boat that we are on is about equality. Now, the NHI carries the potential to transform the healthcare landscape, making the dream of quality, accessible care a reality for all its citizens. Now, I will not go into the criticisms that have always been levied about this type of system we want to establish. The NHI Fund will procure services from public and private providers to ensure all South Africans have access to quality health care. The NHI recognizes the respective strengths and the capabilities of the public and private care health systems. Now, quite often it is said that the private healthcare system is the real backbone of our health, and they have the best of everything. And they always try to downgrade the public health system, and in fact, in a very insulting way, they dismiss it completely. But let me tell you something, what we are trying to build is a Rolls-Royce system of healthcare for all South Africans. That is what we are trying to do. Now, it aims to ensure that we complement the systems and reinforce them with each other. Through more effective collaboration between the public and private sector, we can ensure that the whole is greater than the sum of its parts. The effective implementation of the NHI depends on the collective will of the people of South Africa. We all need to embrace a future where healthcare is a shared national treasure, reflective of the dignity and the value we accord to every South African person's life. Now, I know that there are fears, and earlier we were at the Elijah Bahai inaugural lecture, and I spoke about the fears that a number of South Africans had. Firstly, with the right to vote that all South Africans would have. A number of South Africans were terrified that all these many South Africans, largely black, would now have the right to vote. And they were so terrified. Some of them started collecting tinned food, putting it in their cupboards, in the hundreds of tins and so forth, fearing that a calamity is about to descend on them. We all won the right to vote, and nothing happened. Only progress that started building our nation. And then I also spoke about the right to strike. And the employers were so terrified that these hordes of workers are now going to have the right to strike, and it's going to destroy the economy. Instead, having won the right to strike, we have been able to grow this economy almost threefold since the days of apartheid, showing that there was nothing to fear. They were just fearing ghosts. So now today I say, with the national health care, those who are fearful, those who are afraid, and I say, just think about the commitment that the governing party has always had to building South Africa as a sustainable, growing nation. And this is what nation building is all about. National health care on a universal basis is going to build our nation in a very practical way. Now, preparations for the implementation of NHI necessarily requires a focused drive to improve the quality of healthcare. We have already begun implementing a national quality improvement plan in public and private healthcare facilities, and we are now seeing vast improvement. And let me say, we are seeing vast improvement even in areas where we never thought we would see improvement. In the deep rural areas of our country, we're really seeing great improvement of health facilities. Even in our townships, where even old people go and no longer need to queue up, for instance, for getting their critical care medication. They get it through computer calculations, and they just go and pick their medication up from cubicles. And that is what improvement of healthcare is all about. It's happening in the townships. I go to the deep rural areas in Limpopo, in KZN, in Northwest, and I go to hospitals right in the rural areas. And I'm always amazed that they have the same machines, MRI machines, whatever they are called, right in rural areas. Machines that are able to beam information immediately to doctors in Johannesburg, to doctors wherever in the world, and they are able to do the diagnosis. That is the journey we have embarked upon. Now, that is the improvement of our healthcare. Now, the detractors always talk about the very negative, where we are effecting improvements, where they will talk about, oh, the shortage of this headache pill in hospital X or in clinic Y and so forth. And then they want to bring the whole temple of NHI down. And we say, no, we are improving. Now, in signing this bill, we are clearly signaling our determination to advance the constitutional right to access health care as articulated in Section 27 of our Constitution. Remember, Section 27 of our Constitution is what we all as South Africans said we wanted. We went across the length and the breadth of the country, consulting our people, and our people said, we want those who are going to finalize the drafting in the Constitutional Assembly to insert this type of clause in our Constitution. And the Section 27 says, and I want to read it, it prescribes that everyone has the right to have access to healthcare services, including reproductive health care. And it goes on to say the state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of each of these rights. And it goes on to say, no one may be refused emergency medical treatment. But if you read it more carefully, it says, no one may be refused medical treatment here in South Africa. That is what the people of South Africa wanted. And this is what we are signing to today. That's what we are signing to. Now, Minister Pahla referred to the African claims on health. I want to refer to that as well, because this has been an 81-year struggle. Conceived in the African claims and inserted in that claim is the following. They had a paragraph talking about public health care and medical services. And they said, we regard it as the duty of the state to provide adequate medical and healthcare facilities for the entire population. Carefully listen. Not for a section of the population, for the entire population of the country. We deplore, they said, 81 years ago, and deprecate the fact that the state, and they used to use good English, we deplore, and they were very educated, these, we deplore and deprecate the fact that the state has not carried out its duty to the African in this regard, and has left this important duty to philanthropic and voluntary agencies. As a result of this gross neglect, the general health of the entire African population has deteriorated to an alarming extent. We consider that the factors which contribute to this state of affairs are these: the low economic position of the African, which is responsible for the present gross malnutrition, general overcrowding, higher mortality and morbidity rates. Now, who are the people 81 years ago who penned down this African claim? I want to give you just an insight of some of them. Some of them. It was an R.G. Baloyi, who was the TG of the ANC, R.T. Bokwe, who was a medical doctor, Reverend James Talata, a priest and Secretary General of the ANC, Godlo, member of the Native Representative Council, Kabane, teacher, Moses Kotani, Secretary of the South African Communist Party, and member of the ANC, Mac Lipodisa, a trader, businessman, Reverend Zed Mahabane, minister chaplain of the ANC at the time, Makabani, Mapikela, ZK Matthews, Mbata, Govan Beki, Mwerani, who was a teacher, member, secretary of the Natal Bantu Teachers Association, Mufusanyane, member of the committee NEC of the ANC, Molema, J.S. Moroka became president of the ANC, Mpitso, Mtimkulu, there were many Mtimkulus, Dr. Pixley Isaka Seme became president of the ANC, Sitlogelo, Selepo Tema, editor of Bantu World, Kliniwe, A.B. Kluma was the president of the ANC, and. Now, this is a galaxy of really outstanding leaders of our people at the time. 81 years ago, were they mad? No. Were they clear about what was needed in this country? Yes. 81 years later, we are achieving the dream that they set out. Now, given that it took 82 years for the African National Congress, that's the governing party of this country, to achieve the freedom that we today enjoy, it has taken 81 years to get an achievement of the African claims. And that is why I'm going to sign this bill. Now, the passage of the bill sets the foundation for ending a parallel, inequitable health system where those without means are relegated to poor health care, as described in 1943. Under the NHI, access to quality care will be determined by need, not by ability to pay. This will produce better health outcomes and prevent avoidable deaths, as they also envisaged in 1943. The NHI is an important instrument also to tackle poverty, as these leaders envisaged in 1943, as they said it was responsible for overcrowding, for poverty. The rising cost of healthcare makes families poorer. It is sad to hear families saying, "Ngiya dokotela, and then I had to pay this amount, and that amount." By contrast, healthcare provided through the NHI will free up resources in poor families for other essential needs. And through this, we will be able to reduce poverty. We will be able to reduce inequality. And this is an essential step on our journey as a nation to make the lives of our people better. The NHI will make healthcare in the country as a whole more affordable. The way healthcare services will be paid for is meant to contain comprehensive healthcare costs and to ensure that available resources are more effectively used. Through the NHI, we plan to improve the effectiveness of healthcare provision by requiring all health facilities to to achieve minimum quality health standards and be accredited. Following the signing of this bill, we will be establishing the systems and putting in place the necessary governance structures to implement the NHI based on the primary healthcare approach. Now, the implementation of the NHI will be done in a phased manner, in a phased approach, with key milestones in each phase rather than an overnight event. Now, some fear that yes, overnight, it is just boom, going to happen. And we are saying it's going to be phased. And if you are afraid of the NHI, take heart and courage from the fact that we are going to implement NHI in a phased manner so as to ensure that every sub-milestone becomes an important one to make the NHI much more effective. So that's what we are going to do. Fear not, I say, fear not. There's been much debate about this bill. Some have expressed concern, some have expressed opposition, and some have expressed support. What we need to remember is that South Africa is a constitutional democracy. We are a democracy. The parliament that adopted this legislation was democratically elected, and its members carried an electoral mandate to establish the national health insurance. So they did not just dream of it on their own, much as they were inspired by what the drafters of the African Claims said in 1943. But they were very careful in making sure that it goes through Parliament, various committees, various consultation processes, and it is carefully considered by all and sundry, including myself as president. Having given it due consideration, I have now arrived at the conclusion that it must be an act of Parliament. Because South Africa is also a country that is governed by the rule of law, in which no person may be unduly deprived of their rights. We have a clear Bill of Rights, we have a really robust constitution, so those who fear that this bill or this act is going to erode their rights, just be rest assured that there is a constitution, there's a Bill of Rights that protects all of us. We're a country that has been built on dialogue, on partnership, on working together to overcome differences in pursuit of a better life for all its people. The NHI is an opportunity to make a break with the inequality, inequity, and inefficiency that has long characterized our approach to health to the people of South Africa, as seen also in 1943. So I would like to say, let us work together in a spirit of cooperation and solidarity to make the NHI work, because the NHI is here, and it is now about to become an act of Parliament as the law that governs health in the Republic of South Africa. I have found my pen, and it is now going to be signed. Thank you very much. I thank you all.
With an applause, another big round of applause. You may be seated. Thank you very much, Mr. President, for those inspiring words. You may be seated. Just a few acknowledgements of some of the dignitaries that have graced us with their presence to witness this momentous occasion. We have the World Health Organization country representative amongst us, Mr. Fabian Ndenzako. We also have the President and the CEO of the Health Professionals Council of South Africa. We have the Chair of the Portfolio Committee, Health Portfolio Committee, Dr. Jacobs. We also have the Chair of the NCOP, Health Select Committee, Mr. Zoisile Njandu. I'd also like to recognize all health professionals that are here with us, as well as leaders and representatives of big business that are also here. Also like to recognize Minister Nzimande. You're welcome, Perpetua. And also recognize Minister Thulas Nxesi, the Minister of Employment and Labor. And lastly, recognize Ubaba Utinangwe, the Deputy Minister of Health, Dr. Sibongiseni Dlomo. We also have, even though I said lastly, the DG in the Presidency, Ms. Pindile Baleni, in our midst. And we also have the DG from the Department of Health, Dr. Nicholas Crisp, who has a lot of work ahead of him in ensuring. Oh, Buthelezi, sorry, my apologies. My apologies. Without any authority to do so. Shanga, welcome. My apologies. I think we are ready now to invite the President. Is the pen there? Okay, the pen is there. To invite the President, the Minister of Health, as well as the MSCs of Health, to come to the table here so we can witness the signing. Denango, you can also join, please. Okay, if we may please sit it, because we're blocking the view of the cameras at the back. This is a live event.
I'm signing here. I hereby, in terms of Section 84.2, read with Section 79.1 of the Constitution of the Republic of South Africa, 1996, assent to the National Health Insurance Act of 2023, Act number 20, and sign the English text thereof, given under my hand at Pretoria on this day, 2024. So I sign where it's written President. And then I then sign where the act has to be assented to.
Thank you very much, Mr. President, and to the Minister as well as the MSCs of Health. Yes, if the Minister and the Deputy Minister and the MSCs can remain in front for a picture. Thank you. If you may remain standing so that, thank you. Oh, no. Yeah. Please. Photographers in front, please do not block the cameras at the back. Thank you. The team. If the team from the Department of Health is here, if they may please come forward and join the picture. Thank you. And that's on my hand. Okay, ladies and gentlemen, at the conclusion, okay, great. Okay. Okay, may the presidency team please join the picture. Advocate Mpafuli, Advocate Jele, please come forward. Just take off your tag. After this one. After the presidency team will invite members of civil society to also take a picture with the president. Okay, thank you very much. Mr. President, please remain in that position. Members of civil society, please come forward. Yeah, you take one at the end.
Did you attend that Kupela Utortea or Rowena Utobam? Is it a wheel because the Kupela Uria will go in there after? Confidence.
Thank you very much.
I spoke to him.
Thank you very much to members of civil society. Please take your seats. Now we'll have members of civil society will take their seats.
Oh, yeah. And the minister's responsibility is the museum. Did you manage to secure? Who will auction it? This property.
Somebody is going to auction.
Somebody will auction it.
Thank you very much.
Thank you very much. Thank you very much. Thank you very much. If we may just have the President alone with the signed bill. Thank you very much. We just need to have the President alone with the signed bill. Thank you. And the pen. Thank you, Mr. President. You may take leave of us. That brings us to, if you may please remain seated, ladies and gentlemen, please remain seated. This brings us to the conclusion of the proceedings this afternoon. I'd like to thank everybody that made it.
Where's the Robbie mic? Okay. Okay, can you go back? Most of the journalists are seated at the back. Okay. We are now going to allow members of the media now to engage in a question and answer session. My name is Foster Mohale. I'm the spokesperson for the National Department of Health. It's my pleasure to share the podium with the Minister and the President. Can we check where are the roving mics? As you pose your question, can you tell us who you are, your name, and the media house where you come from? Now we are going to allow members of the media to have their a chance to interact with our principals. So I'm going to allow, I see we've got all the roving mics at the back, and all the respondents are sitting in front. Minister, the Deputy Minister, the MECs for Health, and the DG and other senior officials from the Department of Health will assist with in responding to some of these questions. So I'm going to allow the first question from, just mention your name and the media house you come from.
Thank you, Foster. It's Natasha Piri here from SABC News. Minister Patla, I think you must have seen now the memes that are trending on social media of ordinary people saying that they'll be rocking up in private hospitals with slight headaches today. For the ordinary person who's watching at home and wonders if they'll be able to have a choice of which hospital they'll be treated at, could you just please clarify that issue, since you've clarified the fact that the NHI will be rolled out in certain phases? Secondly, how will you ensure that the NHI funds will not be looted or stolen as the COVID-19 funds? And then thirdly, I know you've touched on it a bit in your speech earlier on, but the reaction from political parties such as the DA and Union Solidarity of threatening court action. Thank you.
Thank you very much. So if you strongly feel that your question has been raised by your colleague, just say Kelakale, then we move to the next person. Next? Who's next?
Good afternoon. Alpha Ramushwana here from Eyewitness News. Perhaps I may have missed it. I'm more concerned about the timelines. I know it's going to be implemented gradually in phases, but can you just clarify how long exactly should it take? I heard the President talking about 2030. Does that mean it will be fully implemented by 2030? Can you just please expand on the timelines, Minister? Thank you.
Thank you very much. Short and sweet. There's a ENCAO. Just next for you.
Hi, Minister. It's Amanda Koza from News 24. Please, can you explain in detail just the practicality of how it's going to work to the public. Thank you.
Short and sweet. This another hand that side, ENCA that side, then we'll come back to the side.
Thank you. Slindelo Masigane from ENCA. Now, during both speeches from the President and the Minister, you alluded to the fact that there was a wide consultative process. But it seems there are at least 6 or 7 challenges that we can expect in court following the signing of this bill. Can you just explain to us what, in your opinion, you believe is the resistance to the NHI?
Thank you. Next. Who's next? This side.
Thank you so much, Junior Kumalo from Newsroom Africa. Firstly, Minister, nothing seems to have been amended from the bill. So there were thousands of submissions on the bill those submissions taken into consideration. Also, 5% of the GDP already goes to healthcare. So is this an admission that that amount is not enough in its current state, the 5% basically? And power seems to be concentrated in your department when it comes to NHI. Surely this goes against the basics of good governance. Where will the oversight come from? Thank you.
Thank you very much. We've got the last question before we allow the Minister and the MECs and the Deputy Minister to assist.
Thanks very much. This is Ndando Tukwana at Bloomberg News. Minister, in your remarks earlier, you said that the NHI started a long time ago, the work on the NHI started a long time ago, and you then said that the signing today is not an electioneering move. And my question then would be, why did it take so long to eventually sign it?
Thank you. I'm going to allow Minister. Minister, when he was presenting here, he was not representing himself. He was representing all the leaders who are here, the MECs, the Deputy Minister and the DG. So if we cannot be able to respond to certain questions, we'll allow others to assist. On that note, I'm going to allow a Minister to come and lead with the responses. Then he will be able to allocate other responses to other participants. Over to you, Minister.
Well, thank you very much. Thanks for the engagement. The question of maybe the misunderstanding or the expectation that people can, I've seen some in a satirical way showing people who say the moment they get a headache, they are going to rock up at any of the private hospitals. Well, some of it may be genuine misunderstanding, but I take it, South Africans are very humorous. There is humor in South Africa on everything. Even the most serious issues, you just watch everywhere, you will find some humor. So I'm expecting that some of those are really just in the context of a lightheartedness, but in the serious manner, we are quite, we are very clear about the fact that this is a momentous occasion today where we now have the law through which we can be able to start the real building legally, so with a framework of a system which will ultimately achieve equitable access to the health facilities in the country. So we want to just emphasize that at every step, as the President also emphasized, as we establish the institution, as we roll out some of the programs, there are some of those which already the team in all the provinces have already been doing, some of the basic, capitation work. So as the programs of actual implementation start rolling out, everything will be communicated. When we start with the establishment of the institution as well, we are in any way bound by our own constitution and law to make sure that there is public participation. So we just want to say to people that, be patient. The changes are starting, and you, in not a very long distant time, you'll be able to see. Maybe let me, so that I don't come back, let me deal with the timelines, because I think the two are basically related from Eyewitness News. I'll come back to the issue of the corruption funds, potential of funds missing, and so on. In the bill itself, at the risk, and I know during the parliamentary process we had a lot of debates about this, whether it was safe to state in the bill. The members who are in the parliament will remember whether it was safe to state timelines, but there was a strong view that it will otherwise look like utopia if there are no timelines stated in the bill. So we finally agreed that we must just amend because of the COVID, but we must remain with commitment to timelines. And so the bill speaks of two phases with timelines, which says the first phase is from 2023 to 2026. And that first phase is to deal with the establishment of the institution, accelerating, strengthening of the health platform, and all other basic instruments, which we have not gone into a lot of details. Many of those have already started, even the acceleration of improvement, as the President was saying. The President himself and myself and many others, and even ministers before me, and with the support of our partners in the Treasury, we have agreed, and we are implementing various quality improvement programs in all provinces. All MECs can tell you, it says that in terms of the various improvements which are being rolled out from primary health level right up to specialized services, equipment, as the President was indicating, digital x-rays, all that, in all provinces, those are being rolled out, those improvements. So we will be consulting further with the Minister of Treasury to look at some further acceleration, and we have agreed that, including where we may not only rely on the normal fiscus, we're going to have to look at other, kind of measures in terms of funding models through which we can, both in infrastructure and in equipment, where we can be able to accelerate. So that is the first 3 years, from 2023 up to 2026. So within the middle of 2026, then 27 up to 28, we now, in terms of the Act, it commits us, although some element of actual programs should be starting even in the first phase. But when it comes to the second phase, it must be more intensive conclusion of actual implementation programs in terms of contracting of services. Of course, in the public sector, it's much more easier to accredit and be able to include those which, there are a number of public health facilities which even tomorrow, especially at the primary health level and even at some of the district services, which even, as early as tomorrow would qualify in terms of the Office of Health Standard and Compliance, which is doing these assessments. So that is the second phase. We do acknowledge also that even though the second phase will be really focusing on actual implementation of the programs, the purchasing of services, this will be built up even in the first phase. The bill also commits us to look at vulnerable groups, and somebody said to me, but we already have free services at clinics. So what is going to be new in the primary health now? And I've said, even though we have free services at clinics and community health centers. There are still a lot of primary health services which are not part and parcel of our package. We don't have enough, for instance, in terms of physiotherapists, in terms of hearing audiologists, dental therapists, dentists, and various other key services which must be part and parcel. And also when we say primary health, we also include general practitioners, GPs. We want to get in this first phase to conclude through this capitation, making sure that at various district level, we enroll more and more of GPs to provide services. Not only in the pilot period, we're looking at doing that only at our health facilities. We want this model now to look at where even GPs at their own rooms, once they meet the standard, they can actually enter into agreements so that, and to do that, of course, it will mean that there will need to be some kind of further funds injection. And we have some idea in terms of some low-hanging fruits, in terms of possible funding, which we must, of course, the custodian of any public fund is the Minister of Finance, and we are engaging in that regard. Security for the funds, already before even this signing, about 3 years ago, with the leadership of the President, there was already a health sector anti-corruption forum, which has been established, which those who were at the Presidential Health Summit will remember the SIU did give an update of a report in terms of some of the areas where the forum has been able to intervene. We've got the SIU, we've got the police service, we've got a number of other, health agencies involved. But also within the control systems, we definitely are committed to make sure that through all the various accountability systems, through a very transparent governance system of the board and the various committees, but also this is an entity which we must report at any given time in terms of timelines, quarterly and so on, to Parliament. We must report to Parliament on a regular basis, but it can be called also at any time if there's anything which is suspicious. It can be called to Parliament to account. Now, also the issue of the court, I think the number of other people who raised that from the DA and Solidarity, and I think Slindela did say there's about 7 you are aware of who are threatening to go to court. Well, this is a real radical departure, and it therefore, when you want to move from a comfort zone, there will be a lot of people who will be unhappy from just from a comfort zone. People are used to certain way of things, but also there are also vested interests. Some of the organizations, if you trace historically, and I don't mean to enter into election politics, but if you look at the constituency of some of those organizations, you will find that they've benefited not only in terms of the lack of radical transformation in the sector since democracy, but they had benefited from even the previous dispensation. And they have had the comfort of benefiting even more in democracy, building even more assets in the course of democracy. So anything which threatens that comfort is going to be, a challenge to some of these organizations. So we accept the fact that that is so, but also, as the President has mentioned, we are in a democratic country. The courts are part and parcel of our democracy. We've got a constitutional democracy. We know, even people who disagree in the church, they go to court when they differ in the church as to who must be the bishop. People who disagree about the nduna and the chief, they also take the matter to court. So here we're talking about serious vested interests. So we do acknowledge the fact that that's really and they believe that they've got a point. So we must be ready to go and present our case, because they've said, some of them have said, it's not a question of they may. They are saying it's a matter of time as to when they will go to court. So we do understand that, and that's our approach. So I've dealt with the timelines. Practicality, the question of practicality. Well, essentially in practical terms, what you are saying is that moving forward, we want to start building a system, firstly, where all the citizens of this country will be able to be, they will be able to be on a reliable system of registration, and through which they can be able, once the system is fully operational, they can be able to go to various facilities. If you fall ill in a particular area, for starters, we'll have a portable system with your ID. We are also, just to mention among some of the details, that we also want, we're already quite advanced in terms of including a fingerprint, a biometric system, through which when you, and we will be able to modernize even the health information system, such that as long as you're on the register, you are a citizen, if you are not a citizen but you have particular status and you're registered once into the system, you will be able to access services when you need them at an appropriate level. Let's also just emphasize at an appropriate level. So, if you've got a headache, you will be able to approach your nearest clinic with your ID or the nearest GP. If that GP is registered, they will be able to, with your permission, they will be able to even see your medical history, but with your permission. They will have your ID, your biometric, they will be able to access, and then through that, you will be able to be assisted once the system is operational. And if you're seriously ill, I'll give you an example. Last week I was in George from that disaster. There's already, as you know, some cooperation between public and private, even at hospital level. Some of the people who were injured, the following negotiations between the George Provincial and the private hospital, a number of patients were taken to the private hospital by agreement. But one of the things which now had to follow with Minister Nglesi's department, using the injury on duty provisions, was to then start looking at, because the public sector is fine, this is the emergency. In fact, there's not even an issue about those victims, those who survived, having to pay. But at a private hospital, somebody has to pay. Somebody has to pay. So we're looking at the issue of whether it will be from COIDA or from any other source of funding. Whereas if we had already reached what we are building into, as long as that person would have been, first of all, in an emergency, it would not even matter whether you are registered or not, you'll be able to access the services, because all facilities without cost at the place of treatment, they will be obliged in an emergency. But even in a non-emergency, once we reach that stage, and let's say that private hospital is part and parcel of the NHI system, the people who would have gone there would have got their details and know that they are registered into the NHI system, and they will be treated, and there will be no further follow-up in terms of saying, because they will be covered, because there will be an agreement in terms of how those facilities will be reimbursed. So that's really what we are building towards access with the information systems, which will make it easy for people to get services wherever they may fall ill when they are in those particular areas, and not worry about the fact that they will be followed up with a bill. So that's really what we are building towards. I think I've dealt with the court and the resistance. Well, the issue of, I think there's gentleman, I can't remember from which media, who said that there was no amendment. That's not correct. From the bill which we submitted to Parliament, there were a number of amendments which were made. The members of the committee who are here can attest to that. The fact that we're already using sufficient proportion of our GDP, what we are emphasizing here is, yes, we're actually not at 5%, 8.5% of GDP, which is already, but we are saying more than half of that 8.5, around 250 billion rand or so, actually is utilized for only 15% of the population. That's the inequity and inequality and a lot of wastage on the other side. On the public health side, there's a lot of dead space, a lot of facilities which are underutilized, and as a result, because they have to be the owners of those facilities also have to not only pay for them, but they must also declare profit to the shareholders on the stock exchange. They then have to find ways. That's why you will hear a lot of stories about some of those institutions saying somebody who was in the ordinary ward, when they get discharged, they say they were 5 days in ICU so that they can submit a bill for ICU. So that's the perverse incentive which is there in this kind of commodified system. So that's why we are convinced that with a proper management, there's too much, there's over-servicing, but there's also overcharging. I mean, you go to, and to see that, you will find that one for a same service, even here in Tswane, there are different private hospitals. I can bet on my last rand, if you break your leg now, please don't break your leg. And if you go just across to the hospital, just across, not far from here, there's one which is not very far. But if you then say, I still have some time, let me go to the east. There's another one down here of a different company, just across Gezina here. If you were to break the same leg, the same bone, one goes here, the other one goes that side, one may pay double to get that leg fixed between the two hospitals. But they will have the same x-ray machines, the same equipment, and the orthopedic surgeons will have been trained by the same university and all that. So we know, ladies and gentlemen, that this is doable. It's being done in various countries where we are learning. With the economy of scale, all that we are saying going forward is that this NHI will go to all these people and say, for a fractured tibia and fibula, what we call in medical language, a tib-fib fracture, or a hip dislocation, whatever. This is the standard. This will be the standard. So as the NHI fund, and it's done in various countries. As the fund, I'll give you just an example. One of the CEOs he was telling me that their group had to leave the UK. And he said, we tried to compete with NHS, it didn't work. Because the NHS will give you a number of patients and say, we've got a backlog in hip replacements. So we're going to give you 100. But for that 100, we'll pay you so much. Take it or leave it. So you will get the patients. They will not pay anything because the NHS will pay for them. Because they've got a backlog, they'll give to your private institution, but they will give you the price. And he said, it's up to you to then work out how you're going to make do with the work. And so there's very practical examples of how this would work, and we can reduce the high costs and the duplication and the overcharging. I think I've dealt with all of them, Foster. I hope there is no more questions.
Okay. Let's check. Thank you, Honorable Minister. Let me check if we don't have any inputs from DM. Any input? DG? DDG? MECs? Okay. On that note, let's get the second and possibly the last round of questions. I see hands that side. 1, 2, yeah.
Thank you so much and good afternoon, Mugale. Francis Loagamachate from Progressive Independent News Agency. I guess none of us knows who will be in government post the 29th of May. So with the term of office coming to an end of the current government, what are the implementation transition plans in place to ensure seamless implementation of the NHI? Thank you.
Thank you. Next.
Good afternoon, Minister. My name is Rorisang Khosana. I'm a journalist at Times Live. I just wanted to understand, with the NHI, when it's in full swing, where does that leave medical aids? Where does that leave those that are covered with medical aid? Thank you.
Next. Also talk about those who are not covered by medical aid. Next.
Afternoon, Minister. I'm Matsidi Sosetai from Free State FM. I hear you saying that the NHI is going to be phased in. I thought that when it was piloted, because at different districts, there were pilot sites. In Tabumfusanyana, where I come from in the Free State, there was a pilot site. So what were the pilots doing if you are still going to be phasing in the implementation? Thanks.
Thank you. Next. Okay, it looks like the message was clear, loud and clear. Maybe we can deal with this last few questions. Looks like the Deputy Minister will be able to clarify these last few questions. Over to you, DM. You got it?
No, the Minister will deal with those difficult ones. The pilot sites are, some of us as MECs, former MECs, are able to actually answer that one much better. Because we are envisaging a situation that what would be an ideal hospital clinic that we would like to see once NHI is in place. So actually it dispels those who said pilot sites failed. So why are you moving with NHI? We were very clear that we want to benchmark what is a baseline that we have in the country in terms of infrastructure. What is our ideal that we would like to have? So yes, you are correct, Tabumfusanyana and many all over in the country, each province had a pilot site. And then out of that, independently, there was a creation of the Office of the Health Standard Compliance that says to get to these characteristics, somebody must whip you, must always be there to check how are you getting to what we call an ideal clinic, an ideal hospital. So that is where we are. Therefore, so pilot sites were just to give us how to start, what is our gap to get to where we want to be. And we are therefore saying all facilities that will actually deliver NHI will those that will have been accredited by this independent Office of the Health Standard Compliance moving forward. I think that is one that wanted you to. But the other last part that I was tempted to talk about was with the issue of there were no amendments. As a former chairperson of the Portfolio Committee, together with the Comrade Ken, who has since left, we made amendments. I can just give you one now. There were issues that were, firstly, let's just agree that if people come and present, which we listen to all of them in the Portfolio Committee, it doesn't mean that we are therefore going to change everything or part of the things because we have listened to them. But even the opposition parties now, they are saying, even if we go to court, we will not be going to court to actually say you flouted the process. We were very clear, the process was very clear legally. They may just be going to court because they do not agree with the content, but none of them will actually say we're left behind. In fact, as we were doing public hearings as a portfolio committee, we received 118 submissions of this institution, that group of people who came to present their views in the portfolio committee. So none of the people were left out. Consultation was very wide. We could not consult longer than what we did. All those institutions, 118, despite public hearings, who requested to come and make their submissions, were given a space. It's just that when you actually come and talk, we would fundamentally hold on to what we think is NHI and would not necessarily change the whole process. Where you have come to make a submission. Your submission is noted. Just to give you an example, there were clauses where it was saying the minister shall appoint, the minister shall do this. We amended as a portfolio committee that process to say the minister, in consultation with, and we mentioned various bodies that the minister had to consult to actually come to then make that determination. Thank you very much.
Yeah, maybe just to add on the input by the Deputy Minister on the pilot, to say the things, some of the things which we said even earlier, that we have learned a lot of lessons. We have made, some of the basic steps, not just in infrastructure, even in terms of equipment, in terms of the health information systems, the health patient registration systems, starting with the pilot. Now we have reached the stage where we are now rolling. We started with the pilots, now we are rolling to the whole country to make sure that the health information, the equipment which are required, and all that can be able to be, because we now have the experience to can roll out to the rest of the country, as long as we can be able to fund that. The transition. Well, you see, the beauty of government and state is that while parliament and parties may come and go, but the state remains. When you pass a legislation, it may have been passed by a particular group of MPs. They may even belong to a particular party in the majority, but it becomes an act of the state. And even if, whether within one party or even in parties, there may be changes, because that's a system, political system ensures that even within parties and even between parties, there will be changes from time to time in terms of who's in charge, but the state and government remains. The officials who were taking pictures with the president here, starting with the DG, and DDGs and the directors, they are not going for elections. They must implement the law. The president has signed the law, it must be implemented. Whether Pasha is not there or not there, whether Dlomo is not there, whether MECs are changing or whatever, the law will be there. It will be governing how health must be transformed going forward. They can't say this was I didn't say this was a Mutwaledi bill or a Mkhize bill. I found it, I ran with it. Whoever comes at the political level will find it on the desk, says implement, must implement. And the DGs and the DTGs will be having programs which will also be now, liable for funding. Because you see, when you have an act, you now have the power also when you go to budget with the treasury to say, this is in the act passed by parliament, we must do A, B, C, D. That function must be funded. And then the treasury must allocate the funds so that you can be able to implement the law. So don't worry about 29th of May. This, what the president has done, closes the picture. 29th of May is irrelevant. The law is there. Whoever comes, if they want to try maybe go to court, it's fine. Whatever happens, they may try it maybe in Parliament if they think they've got some better power. It's going to be a struggle. Struggle continues. But as that struggle continues, the law will be there. And they must implement it. So we don't have to really. Now, the last one in terms of medical aids, please, I saw also on some of these hilarious statements, I hope it was just somebody was sending a message, tomorrow I'm saying cocktail medical aid. I'm not paying for this bloody medical aid. There was somebody who was sending a message, 30th of May, no more deduction for medical aid. We want to say to all South Africans and everybody, if this is a process, when that is ready, you will be informed. The medical schemes registrar, the chairperson, Dr. Mabiba, there is a chairperson of the Council for Medical Schemes. She will tell you when your medical scheme is no more relevant, together with the CEO. As it is now, she has not run out of a job. Medical schemes are still there. She still has to regulate them. And even when their scope and responsibility changes, she will make the regulations to say all maternity is now covered under NHI. In terms of regulation number this and this, as from this day, don't deduct from members about maternity. Maternity is now covered by NHI, primary, secondary, and even cesarean section. This is and when they say it will now be covered by cesarean section, it doesn't mean the hospital will just put a price. No, they will be told a cesarean section in a private hospital is 100 rand. That's what will pay you. But you will get the patients, but not the current situation where private hospitals are doing 90% cesarean section. You know, the norm is supposed to be around 25% or so. They are doing 90%. Because why? Keep the theaters busy, get more cash into the hospitals. So keep your medical scheme, everything will be transparent. The day when it reaches certain reduced coverage, Medical Schemes Council and the ministry will announce when everything, all basic services are covered, hopefully by 2028 and going beyond. Those announcements will be made. Please don't throw away your medical scheme and don't stop your stop order by tomorrow. Thank you.
Thank you very much, Honorable Minister, Deputy Minister, MECs, and everybody. That was the last round of questions. The rest we can entertain them outside this formal event. In the best interest of time, let me unofficially, delegated, take this opportunity to welcome everybody who made it to this very important and historic event. Indeed, the journey for better life for all South Africans has begun. So on that note, I'm going to declare this media interaction session adjourned. Thank you.